in over there. When we do need to do video, we'll just have to do a new share.
Yep. So we're gonna continue,
Select the video.
and then,
Say we.
expand
It's gonna be-
it.
Everybody,
Yeah.
just let me know.
Okay.
If you're ready. I'm gonna be right back here.
Okay.
And then if there's any questions in chat, I just raise my hand and I'll
Right, but it might not.
verbalize those for you.
Okay.
It should work.
Like this survey
It is working.
Oh, there we go.
Okay, great. Got it. It seems to have a small history of, yeah, I don't feel like working, push the button a few times and then.
Okay.
You should be all set.
Great.
Shall we get started? Is everybody? Great. Thank you for being here, Mohamed. I'm here to talk about the utilizing cross-college collaboration to address rural pharmacy needs, which is basically taking a bunch of people who had no idea that even existed across campus, putting them all in a room and trying to solve a problem. And the reason we wanted to do that is because it really helps students understand a real world situation where they're going to be not siloed in their own kind of profession or major to solve the problem, but they're solving it with many other disciplines and getting to a solution faster. So we wanted to take this state of Michigan grant that wanted to research how to improve the viability of rural pharmacies in Michigan and improve patient and customer access to care. So it started in the summer of 21, May through August of 2021. We had to start with some research to figure out what we were doing. And this is our initial team. And it started with John Moroney, who is the professor of product design down at KCAD, also the director of our KCAD Innovations Hub. Does anyone know John? I'm surprised, he knows everybody. Yeah, John knows everybody. So John can put together these teams that go across all these different colleges because he's sort of our octopus. He has his hands in everything. So he put together this team. Michelle and Michael from the College of Pharmacy helped us out. Alex and Mohamed from the College of Business. I came in from KCAD on the design end, and then we have Kris Emery, who is our outside advisor, kind of guru of all things healthcare with Spectrum Health. So she can help us with that connection between the college and the healthcare system. And then we brought in a student to start this research with us too. So Hayden Prowitz from the Master of Architecture program at Kendall joined the team early and then stayed on and is continuing to work into this semester. So she's made sort of a year's project of working with us. So we started by going through several different places in Lower Michigan, finding rural pharmacies that we could talk to and see current conditions, what things are like, what their business is like, asking about their current and future plans, and finding out those pain points so that we had a good understanding of how to address a problem based on what they tell us the problem might be. And this is what we saw. We saw consultation spaces that were also a pharmacist's office, or a storage room, or just some leftover space with chairs. We see that retail space is dedicated to knickknacks, tourist items, candy, sodas. The pharmacists and technicians can get hidden behind tall counters with over-the-counter items. So if a pharmacy wants to be seen as a healthcare destination, these things sort of get in the way. Oops. So that we came up with our central question. How can we help independent community pharmacies achieve financial growth by collaborating with healthcare providers and shifting their business model to focus on the delivery of healthcare services. In essence, how do they become a healthcare destination and work in partnership with healthcare providers? So all that research then broke out into 3 classes. We came up with a design class that I led, the app development class, which Mohamed led, and then a pharmacy class that Mike Klepser led. And that took all of fall 2021. In the design class, we broke it out into two groups. One group looked at the space design. One group looked at the user interface, user experience. How do we tie technology to the space? And then Mohamed connected all that healthcare.
We kind of connected the healthcare systems using the application. The big problem for pharmacies, as we mentioned, is basically they have their own system that's separate from the hospital. So if you go to the pharmacy, you're talking to the patient saying, oh, I have this diagnosis, I have this prescription, I have that and that. As a pharmacist, you don't see that. You see just the prescription that came in the past. You don't see the full file. So we're building an app to connect the health system to the pharmacist application. We're building new apps for the patient as well to have more connection to the system to follow up on things like adherence, reminders for medicine, and all of that. And these are all pain points for the pharmacy for success, especially for rural pharmacies, all built by the students.
And what he's not telling you is that every pharmacy is different. So he's trying to come up with an item that works for a lot of things. So his job, way harder than mine, way harder. And then Mike's class, actually their innovation in pharmacy practice class, is studying the business of pharmacies, and their students integrated increased service model into their business plan to test the feasibility. So they did SWOT analysis based on what we were putting together with the app in space. So all of those ran simultaneously, sort of as 3 parallel tracks with some crossover, but mostly running fast, all in the same direction, just running separate. So within the design class, we brought in a pharmacist. So Michelle came in and helped us out with her expertise, talked about how the pharmacy works, what the layouts are, why the layouts are as they are, what the workflow is, etc. And then we've always had access to our clinical specialist, which is Kris, who helped us understand integration with that health system, what a patient might need. She can really emphasize with what the patient aspect is as they come in through the space. So with those experts helping us get up to speed as a class, the space design students came up with the observation, obvious as it is, that spatial layouts are highly influential, which just means every pharmacy we visited was different. Every layout was different based on the architecture. So the students couldn't come up with a space plan or a layout that would be universal or usable for everybody. Circulation should be counterclockwise, again, to follow human activity. The decompression zone of 10 feet when you walk in the door needs to be respected so people can understand where to go, what they're looking for, and that lower shelving heights open up space. And again, that helps connection because they also wanted to increase one-on-one experiences with the techs and the pharmacists. They want to improve patient education programs, keep people on track with their meds. They want to improve the utilization of telehealth services. And again, that goes back to what Mohamed's working on, keeping people connected to the pharmacy through telehealth, and then increase the features of the private consultation space so it's not just a storage area. It's not leftover space. It's not the pharmacist's office. It actually has more uses that are more driven by patient needs. The UI UX team then benchmarked existing apps to see what was good, what was bad. They went with the big 3 to see where they are. So they had a good starting base of what people expect from an app because these are so widely used. And then the space team and the UI UX team decided the application is the thing that ties a space to the patients and customers. It's the bridge that brings people from their home or some other location and ties them to the pharmacy. They also decided that because all the spaces were different, they had to have a modular approach to the design. So they had to have a modular module that would allow for consultation, a module that would act sort of as a lab, a module that would handle the retail and the pharmacy space, and a module for community health. And those modules then can get put into a space, into the architecture, in any formation they need to fit the building. This would be an idealized space, nice and square. All those modules fit in there nicely. We can have the pharmacy, we can have the retail, community education, consultation, a waiting area so that there's some privacy when you wait, and then our lab area, which is where we might go for injections or point of care testing. And the app had to be just as clear, just as easy to maneuver and understand. So the login page, the onboarding was minimized with graphics, minimal things on that screen, so people could understand what to do, how to do it next. Then when they refill a prescription, which they can do on that app, they know to come in and pick up and have a space to have a conversation that's not in the middle of a retail aisle, and get that information from the tech or the pharmacist with some modicum of privacy. And the pharmacist, oh, it does play animation, good. The pharmacist then has their app that they can access patient information. And again, this is what, I feel so bad that you have to navigate all these things, but this is what Mohamed's team is trying to navigate so that all of this talks to the patient through the app. You want to talk a little bit more about that?
Well, it's a great summary. I mean, we have both sides. You have the pharmacist side, you have the patient side. So you're building two applications at the same time. The pharmacist side is typically very strong, dispensing software. If you're in the pharmacy business, there's a ton of companies. Patient apps, though, not as good. You look at patients utilizing pharmacy apps. Even if we look at ourselves, I mean, rarely I've used a pharmacy app. However, if we start utilizing that for following up on adherence on medicine, following up on connection to the pharmacy, opening a communication with the pharmacist directly, then patients suddenly find the value of that, and they can connect it to what they have in terms of the provider or the physician. So there's a lot of potential here, and we're trying to find that achievement.
So the pharmacy and the patient can stay connected through messages and notifications. And that helps keep the patient on track with their medications. So you've got this chat that you can do. You can track how well you're following your schedule for medications. You get reminders. Did you take your pill? You say yes or no. And then to connect the patient with increased services, the app and the space work together to maximize the lab. So a patient can actually make an appointment that goes then to the pharmacist's schedule and blocks out time to be in that room so that you have a kind of a seamless connection to get services as well as prescriptions. And with the anticipated increased abilities to support ongoing patient care, the lab will go beyond vaccinations to support additional testing and treatment. So we wanted to keep that in mind as we looked at that module and keep it as professional as possible, but not intimidating. So some people think an exam room is a bit intimidating. They don't like going to the doctor. They don't like being in that exam room, but you still need some of those pieces of equipment. So the lab wants to ensure visual and acoustic privacy, so they put it towards the back of the space. They want it adjacent to the pharmacy because it's the pharmacist, or sometimes a tech that will have to come into that room pretty quickly to administer the services. They want it furnished comfortably and to be able to seat 3 people. So you can have a spouse or an advocate or a parent with you. It needed to be wheelchair accessible. They wanted to provide hand hygiene, so there's a sink in there for hand washing. They wanted it to be multifunctional, so it has lots of uses, so it gets scheduled throughout the day and throughout the week. And then it has to be telehealth equipped with Title Care, so that you can connect with a physician or a healthcare provider within that space. So in this image, this behind that sliding kind of obscured glass door would be the lab space. And then you can wait in that center space. So the lab space is a room for the pharmacist and the patient, and it's designed to reassure the patient and reinforce the role of the pharmacist as a member of the healthcare team. So a lot of times when a patient thinks of their healthcare team, they think of their primary, the nursing staff, maybe the PT, OT person that they go to. We want to integrate the pharmacist into that team as well, and we want to give them a space that's professional and allows them to do the work that they need to do without feeling as though you're going into a back area. You just want to get out as soon as possible. So it allows for treatment within an exam chair. It also allows for consultation with a table. So the lab is scheduled for services by the patient with the app on their phone, and this is put on the schedule managed by the pharmacy app. So this is the pharmacist side. You can see what people are coming in for. This is the patient side. On their phone, I can say, I need to go get my COVID-19 shot, and then get that scheduled. So then we've got a consultation space. And that consultation space, again, assures acoustical and visual privacy because it's in its own module, and the door, the entry to it is from the waiting space, not the retail space. It's adjacent to the waiting area, so people can have a place to hang out before they go in there. It can be rented out for other healthcare professionals, like dietitians, or someone who wants to do diabetes management. It could be for a PT or an OT that comes to town once a week. It is equipped with Title Care, so it encourages that communication through telehealth. So it's like the lab, but it's used by people other than the pharmacist. Unless the pharmacy is so busy, they need 2 kind of labs. And that's what that would look like when you go in. Again, working space with an open floor, or you can pull the table down and have consultation space. So again, furniture that accommodates several different things that have to happen in that room. And again, going back to the app, a patient will be able to see upcoming appointments, when they need to be there, prepare and upload any required documentation. Again, a nightmare that Mohamed's team is trying to figure out. And they can join a video call without leaving the app, so they can talk to their pharmacist and actually have that face-to-face conversation, which sometimes is the comforting part of trying to understand your medicine or your medical therapy. And then we have our community health space, which is part of our retail space. But again, it could be rentable. If you've got reps that want to showcase new equipment or new treatments, it can incorporate modular furniture that can be moved around for either lecture or education, or straight retail with display space. It's a focal point that's visible from the street, and it gives an opportunity to increase that community engagement as people walk by the store. And you can see it used in a retail setup with display or community space and education mode. Or maybe I'm going to go and learn about benefits of Medicare because I'm going to be 65, or I'm going to learn about the benefits of a certain health benefit package. Or I can learn about lifestyle changes for my health. And again, on the pharmacy side, in the app, I get to see what's going on, whether it's in the lab space that's going to be used for appointments, in the consult space where it's maybe rented out for the day for a Spectrum Health professional coming through, or whether it's in the education space that again is blocked out for a period of time that could be rented. So the pharmacist can track all of that stuff on the app as well, right? In our perfect world, yes, it does. So we came up with the value propositions after all of this design work that we wanted to have growth opportunities, increase use of the lab and the services. We wanted to have consultation rental as another income source for the pharmacist. We wanted to have community education so that people would understand how to best take care of their health. We wanted CMR and insurance reimbursement to be easier to come by than it is now. And we wanted quicker scheduling and refilling for better adherence. So our structure through that fall semester, we had weekly design meetings, and that was our administrative team. So Mohamed, myself, John, Michelle, Mike, Alex, we would all, and Kris would all get together once a week, talk about what we had done, where we are, how are we meeting our goals. We had weekly updates from the UI UX team to the app development team so that as the designers, the UI UX designers came up with something, they could work with Mohamed's team and he could say, okay, we need to understand how we get from this screen to this screen. Who do we have to have operationalized to make sure that this all works? We had weekly updates from the Pharmacy Innovations course as the SWOT analysis work was started. And the UI UX team shared their web-based design work with the app development team. So the Figma boards that they developed could be used by the development team. The design team shared the presentation as well as the modeling work for the space. And the administrative team increased work with Spectrum Health to bring in provider viewpoints and build those relationships. So a lot of stuff was happening sort of all in parallel track to get a very fast moving project to its end goal pretty quickly. So phase 3, spring semester, the app development team is taking the work from the UI UX team and making it work as it was designed. And there we have the video that I bet won't play here because I have to have the video brought up. Help me!
Hey, so I'm Jacob Codell. I'm the front-end developer for the pharmacy app, and I'm just going to give you a tour of how the app works right now. So first, we start here at the login screen. If we don't have an account yet, we can hit sign up. Right now, let's just ask for some basic info. So I'll enter a name. Let's enter my name. Then ask for an email and a password. So I can enter my email here and do a quick password. It'll then ask us to allow the app to use our medical information. We can put whatever sort of consent form we need here. Right now, it's just pulling one from Spectrum Health, but we can hit agree, and that will create our account. So now if I type in my email and that password, we can log in. So that'll take us now to a screen of our current medications. This gives us some basic info here on this screen. Let's say we want to know more about a specific one. We can click on it, and this will take us to this page. We can see the name, what it does, dosage, and stuff like that. Any sort of educational material we need. So right now we can just put in YouTube videos. Say this one is getting low and I'm going to need a refill. I can go up here and click refill. And this will add it to a cart and take me to a refill screen. Say I want to do multiple refills at the same time. I can go here and mark another one. And now we have these two marked. And I can hit order. And then we can order both of these meds at the same time. We are also working on scheduling right now. This is a bit more work in progress. So you have a list of available things to schedule. So you want to look for COVID. You can enter in the search bar and find COVID. This will then pop up a date selector. Certain days will be available or unavailable. So for example, this pharmacy has weekends disabled. Those are not open. You can see a list then of available appointment times. And we can select one, say 10:30 a.m. and schedule it. And I think right now that is pretty much it for the pharmacy app.
I love how he says that's pretty much it. They've had 6 weeks to get this done. This is huge. Yeah, huge amount of work. So yeah, go ahead and tell what you're up to.
Yeah, so just a quick on the process. So what we do, we collect the requirements, we build, the design team builds UI or UX, basically how everything would look on the screen, pick the coloring scheme, and that basically tells us what will actually happen. Then we start developing the app, designing a database, designing the backend. So this, what Jacob showed, is actually running. So this is connected to Epic itself. Epic is an example of an EHR or electronic health records, pulls real data from for real patients if we have the names and users and passwords. And then we're building those features that we've seen in the screens before gradually. But we've made that progress. Hopefully by the end of spring, we have a much richer app with all the features that we've promised.
So I can say from a design aspect, at KCAD, we come up with what a screen should look like. We never really get the opportunity to see it in action. So this is really kind of a nice way of, because we're cross college disciplinary, we can see what other colleges can accomplish, which is really kind of exciting because we kind of work like this for so much of our college tenure within those studio classes.
This is awesome. I concur with that. With the software engineering, our goal is always efficiency of the app. Does it show the right numbers? We would have never, we have artistic students and a lot of excellent students, but on average, we would have never had that nice, organization, UX, coloring scheme, all of that. So, working together is really, really effective.
Hey, so I'm Jacob.
Oh, there we go. So the MR candidate is staying with the team and working through the spring semester. She's planning specific layouts for test fit in one of our initial research sites. So we're working within the floor footprint of a grocery store, and she's taking specific modules, not the retail, but specific modules for the lab and for the pharmacy, and figuring out how those modules work within the footprint of the grocery store. So she's taking that theoretical module idea and putting it into practice. So business planning using the optimized space and additional services is being updated and refined for presentations to independent pharmacy owners, which is why we don't have John and Michelle and Mike here today. Because apparently February 25th is a very popular date for a presentation. So they were in Detroit this morning, presenting this work to Michigan Pharmacy Association. We also want to do presentations to CPESN and the MPA, which is today being developed and delivered, so that we can tell more people about this idea and get more buy-in from pharmacy. We're increasing our involvement with Spectrum Health to support the rural pharmacies and their network, and really getting good real-time feedback from a healthcare provider about the effectiveness of what we want to bring to these rural pharmacies. The state of Michigan is continually engaged and updated for an ongoing relationship as plans continue to be developed and refined. One pharmacy has plans drawn up already to expand services and community engagement. Late spring build is targeted. We have a pharmacy in the planning phase to increase dedicated floor space to a lab consultation space. And we're in the process of putting a mock-up together to show the lab space and community health space in PHR 204. So it'll be right down some street close by here. So College of Business, College of Pharmacy, KCAD, and Spectrum Health all created enhanced learning for students with a real-world collaboration that allows for multiple tasks to be addressed in a compressed time frame with marketable outcomes. So we think it was a win-win for not just one college, but for several and all the students. You have it. Yes.
I got a question. Since they're rural pharmacies that don't have a lot of resources, and you're asking them to put in money, big money, I would assume, to make such big changes, what sort of buy-in do you have with your little group that you initially had? And then, yeah, what do you see there?
So the initial group, one of those initial groups is one we're doing the test fit for right now. So we have buy-in from one of them to do that test fit. Several of them want to see what we're doing, but they're not ready to make any big changes. We are continuing to work with the state of Michigan to see if we can extend the grant to kind of soften the blow of the investment that they may have to make. If they get grant money to do half, would they come up with the other half? But the big thing that is probably going to help us the most are the business plans that are being worked on this semester. So projections based on increased services and what you get reimbursed for based on those services over a 1-year period and a 5-year period. What kind of investment could you make given the returns that we see for those reimbursements? And so that's the College of Business is working on that right now to put numbers together that will really help us understand what the buy-in could be. Yeah.
It's an annual collaboration across all these colleges. You had spoken some to the privacy aspect and having it communicate with it, having everything pretty large. To me, the HIPAA aspect is really seems like a potential hang-up for any sort of a medical app. So how onerous was that to work through?
Yeah, well, it's still an ongoing discussion. Patients, when they already have an Epic account, that is half the way, because they already have the data and they already have some type of approval with their provider to share that data. And Epic itself has a set of applications that are offered to multiple types of providers. So that saves us a little bit. Part of it is with the consent from the patient, and we're banking on the convenience on the patient side that they will be seeing some benefit to kind of share that. The third piece of it is the pharmacist in the vision here will become a provider with added roles. So they will be providing medicine, they will be providing other things, also other services. So it's, we're initially that's what we're banking on as an extra step. Once we actually have patient data, we're going to start looking into maybe the pharmacist shouldn't see everything. they should see very, very specific things that really cater to the case they want to see or specific service they're offering. That's an ongoing discussion for sure.
So with the, I know zero about creating an app. So with that being said, I mean, is there extra security that you have to build into the app itself, or is Epic taking care of most of that burden in our phone security or device security?
Definitely, so there are two things. There's the privacy of who sees what data. And there's the security of, is my data safe? Can a hacker look into it? So Epic does their thing, but we also are responsible because this data goes on the pharmacist software, the pharmacist app. So we're using the latest authentication technology that is called OAuth. So that's incorporated within the app to protect the data. And we need to make sure only the patient and the providers see that. So that's on the security side. On the privacy side, what we talked about in terms of why does the pharmacist need to see it? Is there the patient approval? If they don't have the approval, pharmacist automatically doesn't see it. So we only follow the data from Epic only when the patient approves. And for some pieces of the data, I don't want to get into detail, for some pieces of the data, every time we pull it, it's not like a carte blanche where, okay, you approve once, we can always pull the data. Every time we pull the data, we kind of get the approval by the patient.
And you're also dealing with, if a patient has a patient advocate, how much can they see, right? Isn't that another aspect of that?
Yeah, that's another use case. For now, we're starting with the patient themselves and accessing their user, which password through Epic. So we're sure that they're the same. Multiple aspects. It's complicated with security and privacy. We're trying.
You know, you showed the three apps, like the big CVS. Do they do similar things that you're doing? I mean, I don't have medicine that I would get, you know what I mean, on a regular basis. So, I mean, usually the doctor calls it and I just go get it. So I don't know, is this something that people use a lot already?
Ideally, the set of features that we're building are kind of unique. We're focusing on other things, additional things than the typical pharmacy app. They're bound to do it, but there's always, you know, got to protect ourselves as a user. I've got to protect myself. Look into that fine print of approvals. And, you know.
No, my question was more, is what you're doing new, or is it something that's kind of being done and you're expanding it? Or
so not only on security and private, yeah, in general, it's kind of a unique combination. It's a unique combination. Yeah. So it's not fully new, but it's a unique combination to have within a pharmacy app altogether. So it's kind of nice. And for a rural pharmacy, that's extra helpful because they don't have access to that. They can't get it. They can't, you know, contract with a company. They can, of course, but you know, it's a cost.
Yeah, so if and sort of the immediate hurdle, if you're an independent pharmacist, is that you don't have a CVS app. I mean, so just to have the app is beneficial. But the students that did the research on the benchmarking, they found that communication with a pharmacist is really hard to get to. It's sort of like finding the address for Amazon when you want to yell at somebody. It's just, it's buried in really deep. So they wanted to make sure that communication was something that was easier to do, which is why a lot of people like their rural pharmacist, because it's their neighbor. It's somebody they know, and they build that relationship with them. So they wanted to keep communication kind of a key thing that is not necessarily done by the big three. Adherence was just a reminder, so they wanted to put a little more emphasis on the adherence, make it sort of a gamification of it. And they don't provide an effective med management system, so that is the other thing that Mohamed's team is working on.
So it seems like you've got kind of two separate projects. One is the app.
Yeah, 5 projects.
Well,
But yeah.
looking at this from the side of the rural pharmacists.
Yeah.
One would be the app, and the other would be the space design. And they're connected, but they're kind of separate. And I'm wondering about the.
And then there's the business plan.
Okay, the business plan. So which Ferris be overseeing that? Would that be like a, because I'm looking for, I think about cost effectiveness. I have friends that are pharmacists in rural areas, and I mean, every last dime they get, they're looking for ways to make money, but like I had one friend that said that he made the most he ever made a year, but he also spent more than any time in the year before. So
Yeah, everything that you made from the COVID vaccine was spent on acrylic and masks.
yeah,
Yeah. And there's no magic bullet. And, you know, people will have to invest in their business if they see growth opportunities and services. I'm very realistic with the idea that maybe the app is the only thing they want to invest in because they can't afford to invest in their space. But as long as they have a space that accommodates the services they want to add, that makes sense to me. But a lot of rural pharmacists are in buildings, in layouts that were done in 1970. It would do them good to invest in their space because it will enhance the image that they have with their patients. But, you know, everything comes down to dollars and cents. I get that.
But also the knowledge and insights that are extracted. So business plan, generic that can help everybody. The app itself, the cost associated with it, no pharmacy can live without an app for the next 5 years. So having that base and ready for them, let's save some money. And hopefully the new services that they're projecting that this will help. That's where they'll only enable it using those changes. Hopefully that helps.
I could see the many pharmacists saying, I'll invest in the app, but for the space design, I'll go do my own research.
But if the services that they add, because they now have the app, allows them the income or a reliance on a steady income, then they could invest in it at another time. It doesn't have to be all in all at the same time. So they have opportunities. But I also think people are seeing pharmacies different. We didn't used to see the pharmacist as the person I go to for shots. That was always the doctor or a nurse, or I had to go to an urgent care for something. And I really could get that point of care testing at the pharmacy. I don't have to make that 30-mile trip if I can do it in a 10-mile trip. And so having sort of the COVID shift of I can use my pharmacist for more than I thought I could use my pharmacist for is also nudging this in that direction too.
You got a grant or you're paying us with applying for grant funding.
We got a grant that started last May. So that's when we started our research.
And then are there grants that you've found that to apply for future funding to maybe help out the pharmacies you have said?
I see John hanging out on Zoom. He's our grant man. He wants to jump in. I'm going to let him do that.
Can you hear me?
Yep.
Actually, we applied for a grant and through the Michigan Health Endowment Fund, and we were denied. We were not awarded the grant, and they turned around and said, "We like your project so much, we're gonna write a contract for you to do it anyway." It didn't align with the guidelines for the grant we were applying, but they wanted to move forward, and so this is technically a planning grant, and we've maxed out the financial capacity of that at 200,000. We can apply for up to 500,000 in the open cycle that actually just opened yesterday, I think, for an implementation grant to do some piloting and testing of the model. So that's probably our next logical step, or maybe an extension on the contract with the health endowment.
You want to say anything about how it went this morning?
Yeah, I presented to a room full of pharmacists that I felt knew more about what I was saying than I did, but they were pretty receptive to the ideas. I mean, there were other speakers there talking about the future of community pharmacy. I'm not sure any of them looked at it as holistically as we did, but in general, we got some very positive feedback. I think the organizers for the MPA were pretty excited about it as well. And it was really an opportunity to tease up. I thought I heard a comment earlier about getting feedback or buy-in from the pharmacy community. And we, as part of phase 3, we are going to be issuing a statewide survey to try to validate some of these things as well. So we've got 2 big events coming up, one in May. Ferris hosts their annual pharmacy seminar. And so we'll have some nice rich conversations with that group. And then we'll do a survey to help validate some of these things probably around the same time in May. And so we'll hopefully close the loop on that.
The one picture of all the arts and crafts and the yarns kind of struck me as, you know, the pharmacy in a rural community is not just a pharmacy. And so all your model to me looks like a pharmacy only, whereas it seems to me that maybe they see themselves as something more.
Which is unusual, because that's what I would think too, but when we've
But
had
you-
conversations with them,
They don't.
they want to get rid of so much of that. They
Okay,
just-
but I didn't know why they put that in there, because maybe they needed to, they were creating another service to the community, and so I didn't know where
Legacy, yeah, lots of legacy, you know,
Yeah.
somebody who used to work here thought it was a really good idea to
Okay.
put this EPS stop here. So now we're this EPS and we lose money and we lose time and I can't get rid of it fast enough, but I don't know where to put it. So,
Right.
so yeah, there was a lot of that.
And that kind of inventory is one of the culprits leading to the not sustainability of their business model, right? You've got loss leaders in their scripts where they're barely making margin on script writing, even when it's 90% of their business. And then you've got all their capital tied up in inventory that doesn't turn over. So they recognize that immediately, that that's a disaster waiting to happen. And most of them want to get rid of it and have mainly OTC, related to pharmacy, related to healthcare and some durable medical equipment, potentially, that supports community health rather than tchotchkes and cards and candy and, things of that nature. So not one of them said they wanted to hang on to those things.
They also want to get rid of all the drive-through windows, but I don't know that they can get rid of that convenience either. Right. I think we've got 3 more minutes until we want to turn the room over so we can get ready for the next presentation. But if you're ready to go up and get something to drink and eat, now's the time. Thanks for coming.
Thank you.
Good job, Lee. Good job, Mohamed.
Thank you, John.
Thanks, Dad.
Good to represent.
Anything else in the nickel sky, eh?
Yeah. Ted Flat, I saw your face.
Hey, Sky, how you doing? Good, how about you? Good.
Great.
Haven't seen you in a while. I know, right? Yeah, I kind of got done with that case, and
I was a little concerned.
I'm not sure that we're able to really find how the default, they kind of scrambled themselves out of it, so, yeah, kind of ended, so. Yeah. It was cool, yeah, I need to stop by and just use some fuel.
Hey, whatever kudos you will take. Come on.
Thank you. Thank you for being there.
Yeah, we'd have to,
Taking all that
I just like
technical
to take a sample, run a couple
never
samples,
get out.
see if there's anything really unique, and then do it with my students, or either that, or just take like the data back and just show them, I don't know. It's not, I don't know, I mean, not